Good evening, everyone. Good evening, Congressman Markey. I too have never been involved, but my late husband worked in international management for Ford Motor Company and Chrysler, and we lived overseas for the greater part of 14 years. We lived in Brazil, we lived in Venezuela, and Spain. Members of our family had several experiences where we were required to seek care in the hospitals of those countries. And I can tell you many horror stories. When my daughter had a cardiac arrest at age 6, we were in the mountains of Venezuela, went to a small hospital where the doctor pounded on the EKG machine saying, "I don't know what's wrong." It looked like the old-time TVs you would just pound upon. And they suggested that we go to Caracas for medical care. There she did have various examinations, including the CAT scan, but the physician told us, "Get back to the U.S. as soon as you can. We have the equipment, we do not have the expertise." When we were skiing in France, our son tore his cruciate ligament, and so we wouldn't be the ugly Americans, went to a clinic in France in the Alps. We thought he had gone down for an x-ray of his knee. He came back operated on, no consent, no nothing. 2 months later, had surgery here in Fort Collins. It was a long recovery period. All as I can tell you is when we were in Brazil, the English-speaking nurses there got together and we worked, put our names in the school bulletin, anyone having surgery, which never was elective, if they ended up having to have surgery in that country, it was on an emergency basis. We were asked to accompany the patient to the hospital, not because we could do anything, because the hospitals in Brazil were so poorly staffed. The families were the only ones to observe the patient when they were ill or after they had had surgery. So the nurses went in just to observe so they could go out to the desk and inform someone if we perceived a situation. Our country does have the greatest medical care. There are many countries, including Canada and Germany and France, that are touted as being very superior. They are already running out of funds. Doctors in Germany recently went on strike. And in Canada, they project that the portion of medical care will be close to 90% of Canada's gross domestic product. It is frightening. I also believe there are changes that need to be made in tort reform and greater competition among the insurance companies. I also want to say that we can't forget that the cap and trade still has to pass the Senate. I did own a small business in New Hampshire. If I had still been in business when this came along, not only the cap and trade, but what that would have done to my cost for electricity, but also this health care would have forced me to close my doors as well. The other thing is, my husband worked for Ford and Chrysler for many, many years. He would be turning over in his grave if he knew that President Obama fired President Wagner of GM. He also, for many years, would complain about the influence of the unions. The fact that they now control so much of GM, when people used to say, "How goes GM, so does our country," I hope that does not happen. we have to look hard at some of the things that are being raised by conservative radio, which they are also going to try to silence. Last night, Keith Olbermann, who I listened to just to hear what the other side is saying, made fun of the fact that Glenn Beck had lost 33 of his sponsors and completely demeaned the messages he was trying to relate. We have to support companies to support the freedom of speech in this country.
Howdy, my name is Bob, and Congresswoman Markey. I'm a voter, and I do live in your district. I do have a hint for you, a suggestion, and a question. The hint is, you don't have any credibility. The suggestion is, if you'd like some credibility, don't push, be a leader, be part of what you are pushing. Give up your congressional insurance, sign up for the bill you're trying to push on us. The question is, will you swear before God that you will not push for something that you don't believe in enough to be part of?
I'm a full-time mechanical engineering student at CSU. This is the first really political active thing I've really done with my life in the 2 years I've been working. One thing I've noticed, and this completely flew under the radar of the national media, of everybody who's even, who's looked into it. I don't know how many of you have read the entire 1,000-page bill. I know I haven't, and I don't intend to. It's too long. The bill in section 440 and 1904, page 838, if you're counting. This is under the heading Home Visitation Programs for Families with Young Children and Families Expecting Children. The bill says that government agents, well-trained and competent staff, would provide parents with knowledge of age-appropriate child development in cognitive, language, social, emotional, and motor domains, modeling, consulting, and coaching skills and parenting practices, and skills to interact with their child to enhance age-appropriate development. So this is basically the government stepping in and using their well-trained staff to teach your child how to act and how to interact with other children. And my question to Representative Markey is, do you think that you do a better job than my mom?